Yeah, they doped you up pretty good, man.
So, does anyone have any idea or guesses as to what drug they doped him up on? If you guessed the category benzodiazepines, or more specifically guessed Ativan, then you are correct. So, the generic name for Ativan is lorazepam. The brand name is Ativan, and street names include Candy, Downers, Goofballs, Heavenly Blues, Sleeping Pills. I've also heard Tranks. Ativan comes in 3 different forms. So there is an oral solution, an oral tablet, and an injection solution. And here are 4 clear images of Ativan and its marketed forms. In the upper left-hand corner, there is Ativan as an oral solution. The bottom left-hand corner is Ativan as an oral tablet, and these are like circular little white tablets. Or if you look across the screen to the bottom right-hand corner, Ativan can also be marketed as an oral tablet, but this one it looks like it's more in the shape of an A. And the upper right-hand corner is Ativan as an injection solution. So, question number 1. Which of the following is not a street name for Ativan? If you said C, pet pills, then you are correct. Ativan is a benzodiazepine medication that was developed by D.J. Richards and introduced into the market in 1977. Benzodiazepines work by blocking the GABA receptors to slow hyperactive mental processes such as anxiety. And since it was introduced into market in 1977, it is legal and is FDA approved, but it's FDA approved for short-term relief of about a maximum of 4 months of anxiety-associated insomnia, or it can be used to produce sedation in patients who are just like overstimulated and can't calm down. Question 2. Ativan blocks blank receptors to slow hyperactive mental processes. I'll give you a second to read them and decide. If you chose the answer B, GABA receptors, then you are correct. And question 3. True or false? Ativan is approved for short-term relief of anxiety symptoms. If you chose true, then you are correct. So reasons why people still consume this drug. Ativan is commonly prescribed for anxiety, insomnia, and seizures. When taken in extremely high doses or just misused really in any way, Ativan can cause euphoria, but that's not what the drug was originally produced for. It was produced to treat anxiety and insomnia and the like that. And then people with a history of drug or alcohol abuse or untreated mental health disorders are more likely to become addicted to Ativan. And then the 3 ways that people get Ativan. Most often, people get it through prescriptions, and then they just become dependent and addicted that way. But if not from a prescription from their doctor, then they also can potentially get it from friends or family if they have access to the drug. And if they are addicted and they may go as far as going to street dealers in order to obtain the drug. Question 4. People typically obtain Ativan through which of the following? Now I'll give you a minute to read through and decide. If you chose the answer C, you are correct. So some short-term effects of Ativan include reduced sense of anxiety, insomnia, and tension. As I said previously, if taken in high doses, euphoria can be reached, though that's not the original intention of the medication. A sense of calm, muscle relaxation, and drowsiness, just to name a few. And then long-term effects of Ativan include sedation, disorientation, confusion, financial difficulties, divorce, seizures. And question number 5. Which of the following is not a short-term effect of Ativan? I'll give you a second to look over it and decide. And the answer to that is B, disorientation. Question number 6. Long-term effects of Ativan include all of the following except, and once again I'll let you look over it and decide. And the answer to question number 6 is C, euphoria. So the prevalence of benzodiazepines. More than 30% of opioid overdoses also involve benzodiazepines. And between 1996 and 2013, the number of adults who filled a benzodiazepine prescription increased by over 67%. In 2015, 23% of people who died of an opioid overdose also tested positive for benzodiazepines. So the reason why we are seeing numbers such as this is because these drugs are often co-prescribed, and because these drugs are co-prescribed, these patients are 10 times more likely to overdose compared to those just prescribed opioids, for example, according to a cohort study that I found conducted in North Carolina. And the percentage of persons being prescribed both opioids and benzodiazepines rose to 17% in 2013 from 9% in 2001. Question number 7. True or false? More than 40% of methamphetamine overdoses involve benzodiazepines. And the answer to that is false. And question number 8. In 2015, blank percent of people who died of an opioid overdose also tested positive for benzodiazepines. And the answer to that is C, 23%. So here's a graph just showing the past year prescription benzodiazepine misuse among people aged 12 or older. And if you look at the blue line, that represents ages 18 to 25, which is overall the age group where the benzodiazepine misuse is the most prevalent. And this is also kind of the age range of experimentation, and like we're in college around this age and stuff, so that's kind of what I attributed the misuse most likely being from, on top of like college students having higher rates of anxiety and stuff like that. But if you look, there's still a decrease compared to 2017. In 2017, this number was at 5.3%, and it did drop down to 4.5%, which is still something to celebrate. It's better that it's going down versus going up. The effects that Ativan has on family, community, and society. In families, for short term, Ativan can be beneficial at combating anxiety, insomnia, seizures, etc. But people do have to understand that it's not going to be a long-term fix, and that taking it short term can potentially lead to dependence and addiction long term. And for communities and society, those who are addicted to Ativan typically lose productivity in their employment if they are still employed, and if they're not, then as I have listed, unemployment can occur. Also, there's the potential for violence or abuse, especially when they're going through withdrawal symptoms. They just become more aggressive until they have the drug back in their system. And then some recovery options around here for people struggling with benzodiazepine addiction include Addiction Allies and Pathways Addiction and Recovery Services. And here are my references. And yeah, that's it. Thank you so much for watching.